Ladies and gentlemen, I am going to tell you something about the nasal obstruction. That is how the nose is obstructed or obstruction of nose. Patient come with all age group that their nose is blocked. It may be unilateral, it may be bilateral, it may be intermittent, could be in any shape. However, you have to take the detailed history. I have worked in MAYO hospital, the biggest hospital of this area, or the oldest, made in 1870. People used to come with the problem that nose is blocked. When we used to examine the nose, mostly they had got the D.N.S, deflected nasal septum. We have to then do the X-ray and scan and other things. We used to do the SMR operation. It's an operation which is costing not more than 5 minutes time, and done under the local anesthesia. The patient is going to tell that I'm lying on the operation table. You can see me, I'm doing the nasal operation in operation theatre. I finish in 5 minutes. And the patient, because he's not anesthetized, he's mashallah okay. He can tell, we ask him that naak khul gaya. They say okay. First time I'm breathing from the nose properly. It's a miraculous operation, which gives the result immediately on the table. This, I tell you very frankly, I taught this something about the D.N.S and the SMR operation in KUALALUMPUR Medical College. You can see this, the most prestigious institution of this area. That SMR operation is the first striking force, first line where you can remove the obstruction in the nose. And you can see me, I'm moving with the professor, if the hearts are the principal of that time, in the main block in Patiala block, which used to be the principal office, now it's the VC office. Then I went to represent Pakistan in E.N.T conference in Orlando, where there was state-of-art lecture, especially the obstruction of nose in the smaller age group, say maybe 10 years, 12 years, 6 years. Before it was a school of thought that nose should not be operated before the age 18. You can see me, I'm standing with the Professor Jennifer Derryberry, the president of our all E.N.T specialists of the world. There was a great lecture that it should be done now earlier age group. The operation, name of operation is septoplasty. It is a comparatively less, operation than, because that operation, which is called as SMR, is a bigger procedure, it is a smaller procedure. It can be done in the, children also. Before, it was not there. The whole world, they adopted this thing, and I know septoplasty is giving very good results. Septoplasty, especially in the 10 years time, 12 years, 14, 8 years, it saves the ear problems, because if the septum remain deviated, remain obstructed, then there is a problem in the ear, sinuses problem. Then sinuses problem will give rise to tonsillitis. The patient becomes very much, upset. Then sometimes you have to remove the tonsils also. Tonsillectomy operation is to be performed. To save all these things, the nose should remain open, like motorway. It was the slogan which was put there, in the E.N.T conference in New York, which was the World E.N.T conference again in the Jacob Convention Center, 9th Avenue. There was a speaker from Italy, from Germany, from England, that said that we should do something to open the nose. If it's the obstruction in the nose, it's going to cause problem in all the age group. In older age group, it will cause something, but mostly the things are due to the polyps. The polyps are formed, they obstruct the nose. Patient come to us. I've seen so many patients by this RANA E.N.T hospital, this RANA E.N.T center, where we have got on J Road, Lahore, opposite K.U.A.L.L.UMPUR College, that they come with a great misery, and their mouth is open because they cannot, take breathing from the nose. their tongue is dry, they are upset. We then remove the polyps. Polypectomy used to be performed before. Now we are going another, you see, advanced surgery which is called the FESP, functional endoscopic sinus surgery. We remove the polyps by that procedure. And first we get the CT scan with the FESP protocol. The patient is okay. When he started breathing from the nose, he says that I have come to the world. Before I was upset. Because breathing you have to take throughout, there is no rest to the nose. Even when you are sleeping, nose is working. This is our fifth SAARC E.N.T conference, which I inaugurated in India in ASHOKA hotel. There were 5,000 doctors sitting on the, you see, the biggest hall of that hotel, having the capacity of 5,000 people. There was a slogan in that E.N.T conference that nose should be opened. It should not be closed. If it is closed, it is going to give various complications, the ear and throat and chest also. Then there was a E.N.T conference which I attended in Washington DC, in Nose 2000 and Beyond conference. Professor Karen is the president of American Society of Rhinology. It was his slogan also. So there should be no constipation of the nose. It should remain open. If there is a bone problem, it should be sorted out. If there are polyps, they should be removed. Thank you very much.